You would think motherhood would be a joyous time for a woman, but the reality is many new moms experience what is called postpartum depression or the baby blues. You may not think it could happen to you, but studies suggest up to 15% of new moms experience this type of depression. Here to tell us the causes and symptoms is Dr. Bradley Wajda with Esano Incorporated. Good morning.
Good morning.
You know, I want to tell you my story, Dr. Wajda, because I just had a baby 10 months ago.
Oh, congratulations.
Thank you, thank you. Right when he was born, I had to take him to the emergency room because there was a health concern. And I was emotional. I was crying, and the nurse asked me, do you have postpartum depression? But I didn't feel like I did because I wasn't feeling any, you know, when they say you have postpartum, you kind of want to be distant from the baby. I didn't feel that way, but are there different levels of postpartum depression?
Well, varying severity. As a matter of fact, that's what defines postpartum depression. Many new moms, because, hey, having a baby's wonderful. As you know, it's stressful. And there's a lot of adjustments. I mean, your body's adjusting, hormones are changing, your sleep schedule is definitely adjusting, finances are adjusting. You know, you're now responsible for this child. There are, of course, a lot of new moms that are learning how to take care of a baby for the very first time. And so having some mood swings and depression and anxiety, all that's normal. I mean, you're going to be anxious about the health of your child. But again, as you pointed out, in about 1 out of 7 cases, or up to that, that can develop into something more severe, more long-term. And again, that can vary from a depression that does affect a mom's functioning all the way up to something more severe. I mean, to where they're not bonding with the child or even questioning their own personal safety. So,
is this something we should feel guilty about?
Oh, not at all. Not. Are you talking about the normal?
The distance.
Oh, not at all. And unfortunately, there's a pressure put on new moms. It's the joy of motherhood. Everybody's like, oh, you must be so thrilled. And of course you're thrilled, but there are all those other pressures and so many things that aren't seen. You don't know how much support or lack of support they're getting from their spouse or family, whether they're having trouble breastfeeding. You really don't know what issues are leading up to what they're struggling with, and sometimes they don't feel like it's okay to talk about that or bring it up, and so they might feel guilty, but again, certainly not a character flaw.
We're going to put up a list of some of the causes because I want people to see, you know, what leads to this. As you mentioned, obviously sleep deprivation, anxiety about your ability to care for a newborn, and this could be a big one because especially for first-time moms, like,
sure,
what am I supposed to do here? What's my role? Difficulty breastfeeding, financial pressures, as you just mentioned, lack of support, you also mentioned, struggling with your sense of identity as a mom. What do you mean by that?
Well, when you think about it, and especially for a new mom, and the younger an individual is, oftentimes the more difficult it is to make that transition. You've always envisioned a mom as the ultimate caregiver. I mean, she is the final say. She's the person you go to when you need to know about a need or what's happening or an explanation. And all of a sudden you find yourself in that role. You're like, I'm mom. That can be a little bit overwhelming because, again, whatever identity you have assigned to that role growing up, however you saw your mom, other moms, that you're going to feel a little bit of pressure to live up to that.
Exactly. Okay, and I also want to take a look at some of the symptoms in case people out there are thinking, well, I might have it. Loss of appetite, one of them. You want to go ahead and name
Well,
a few
sure.
of the
There's and these are typical. These are also typical symptoms of depression: loss of appetite, a loss of energy, social isolation. You're going to have sleep difficulty. You're going to have a loss of interest in normal daily activity. You know, you're going to have difficulty concentrating. And then there are some things that are more specific to the postpartum depression, the issues as far as bonding with the child and even caring for the child. So
I want to talk about actress Brooke Shields, because she actually went public with her postpartum depression.
yes, she did.
And she was able to get through hers by writing a book. But not a lot of people have that option of writing a book. So what would you recommend that someone do if they are suffering from postpartum depression?
Well, it is a depression. And for whatever reason, as we've mentioned, there are several reasons. It can be the hormonal changes. It can be the sleep deprivation. It can be the financial pressures. However, because it's a depression, it does need to be treated. And I say that because obviously untreated, if the severity gets worse, then ultimately that can affect the health of the mom and potentially the health of the baby.
And if people do feel like they're suffering from postpartum, they can actually go see you, right, Dr. Bradley?
Oh, absolutely.
And make an appointment with you. You have 2 locations
Yes, we do.
in the Valley.
We're here in Fresno. Right now we're at 1100 West Shaw, but that's going to change. In about 2 weeks, we'll be at Fruit and Herndon.
Okay.
And then in Merced, we're at R and Olive Street.
Okay. Or if you want to read more information, you could also visit esanohealth.com.
Yeah.
All right. Well, perfect. Thank you very much, Dr. Bradley, for bringing it to light postpartum depression, because it is something a lot of women out there do suffer from.
Well, thank you.
Thank you.